chart is that up to now, total confirmed infected cases is 23,958 and killed at least 492 people. Yesterday, the first Malaysian to be infected by the coronavirus is confirmed. The MCA government monitoring committee, so we advocate a mask is a must. Stay healthy awareness campaign aims to sensitize the people to importance of preventive measure and raise their health consciousness. The whole Malaysia, we are facing the problem of shortage of masks. When the epidemic was first reported, the government displayed passiveness and a slacking attitude when it responded casually that the epidemic was not at critical stage. Responses were slow and neither were effective measures implemented immediately, as people were unaware as how serious is the epidemic was. Had the government dealt with the scenario effectively, the tendency to purchase supplies in excess and hold them at home would have been reduced. As more and more people embrace this idea, intensive purchase from the market occur, causing society to panic due to the resulting shortage of supplies, thereby forming a vicious cycle. So the shortage on face masks has remained, even though Ministry of Domestic Trade and Consumer Affairs Minister has assured 2 times to public. Once is last week, one is yesterday, that manufacturers are resume operations and will meet market demands within the shortest time period. So since the government, has do nothing about the mask supply, so we here have some suggestions to the government. We have 5 suggestions here. The first suggestion is the government ought to secure supplies either overseas or local, but we doubt that you can get from overseas because the largest face mask exporter is China. China is a banned export, and other countries, even though within the region, also have restricted the mask export. So how are you going to source it from local? So the government have to convince the people that the supply is sufficient. This is to reduce the scare. Number 2, review the number of supplies or the stock in the country. The government ought to keep a check on the local stocks to prevent face masks on the market to be depleted. Letting the people know that current supplies are sufficient, this will reduce the feeling of anxiety. Number 3, distribute free masks to school, to the communities, or even follow Singapore footsteps by distributing it to the public. Number 4 is monitor the supply. So government can monitor the mask supply through apps. For example, a transitional measure to allow people to show their IC to designated pharmacy and restricting each person to purchase up to 10 masks per week. And the last suggestion is to set up a hotline for this is the disease control. So now government have actually announced that in the whole Malaysia that there are a couple of hospitals, that you can go to visit if you are suspected to commit this disease, but there are no hotline.